All right, good afternoon, everyone. Thank you so much for joining our Using PSYCKES for Crisis Work webinar hosted by the Office of Population Health and Evaluation. My name is Michelle Raum, and I'll be leading us through today's PSYCKES training. So just some housekeeping items before we get started. All phone lines have been muted to help prevent any background noise, but you're still able to ask any questions today using the Q&A feature in WebEx, and that should be located on the bottom right-hand corner of your WebEx screen. So just type your questions into that Q&A feature. I don't believe the chat feature is available today, so if it is and you see it, just make sure you're entering your questions just into the Q&A option. And we will be recording this webinar. The slides and the recording link will be emailed to everyone afterwards and also posted to our public website shortly. So we have a lot to get through today. Here's our agenda. We'll do a PSYCKES overview, including what is PSYCKES, who's included in PSYCKES, what data sources do we have, what reports do we have. We'll go over accessing client level data. We'll talk about recipient search. So this includes some population health crisis related filters we have in the recipient search screen. We'll run an example search and look at an advanced view. We also have my QI report, so we'll go over some quality improvement, crisis-related measures. Then we'll go into the client level clinical summary and review some client level details within there. And we also have a PSYCKES mobile app. So I was planning on doing a live demo, but that's not unfortunately able to happen today. So I will have some slides that go over some cool features that you can use within our PSYCKES mobile app. And then at the end, we wanted to get your feedback as our users to see, what enhancements we could make to the application that would be helpful for the work that you do. And then we'll end with training and technical support and answer any questions that come in at the end of the webinar. So let's get started with our PSYCKES overview. So PSYCKES is the Psychiatric Clinical Knowledge Enhancement System, and it's a secure web-based HIPAA-compliant application that integrates Medicaid data and other state database sources into one application to help support population health, quality improvement, care coordination, and clinical decision-making. And we do have ongoing data updates, so our quality indicators are updated on a monthly basis, and those client level details within the clinical summary are updated weekly. Now, who is viewable in the application? Right now, we have over 13 million individuals in PSYCKES, and that includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatments, or folks that have had a state PC inpatient or outpatient service, or individuals who are health home outreach or in a health home enrolled. And that's coming from the DOH MAP data source. Now, PSYCKES does have data across the treatment spectrum. So it's not just subject to behavioral health data. It also includes general medical information, crisis services, of course, residential, lab and pathology, dental, vision, and more. Now we have a few different data sources feeding into our application. So our clinical summary provides 5 years and beyond worth of data. And again, it's updated weekly. So our biggest data source that we have is Medicaid billing. So all Medicaid fee-for-service claims and managed care encounter data is coming into our application across treatment settings. But with our Medicaid billing data source, just to mention here, there is a bit of a lag from the time the service occurs to the time it shows up in the application. Something like medications, we consider those a little bit quicker with a quicker turnaround time from the time the medication's picked up to the time it shows in PSYCKES, and it could be as short as 2 weeks. But things like outpatient and inpatient services can take a couple of months from the time the service occurred to when it shows in our application. But that's why we have our other data source set. It's our state administrative databases, and those are more real time with a 0 to 7 day lag here. So we have a few options that we're showing on our screen for state databases that feed into our application. I'll just mention a few. We have New York City Correctional Health Services. So if somebody has spent some time in a jail-based care setting, we will have that data in our application. We also have Department of Homeless Services data for New York City, health home enrollment and CMA provider information from MAP. And we have the name and the contact information for the health home as well in our application. If somebody spent some time in a state PC, we have state PC EMR data feeding into PSYCKES. We have AOT, ACT information, residential and adult housing program information coming from CARES, and then suicide attempt information. We have that coming from NIMERS, and that is all available data. So even if a suicide attempt occurred 15, 20 years ago, that would still show in our application. And then we actually have safety plans, screenings, and assessments that can be entered in by you as the provider into the application through PSYCKES My Choice. And then lastly, we have intensive mobile treatment, AOT referral under investigation, and our newest source of data, mobile crisis team information coming from DOH MH Maven. Now, in our application, we have what's called quality indicators or quality flags. So PSYCKES identifies clients that are flagged for a quality concern to help inform the treating provider and to support that clinical review and quality improvement. Now we have statewide reports and MyQI reports, and those are updated monthly. And this is where you can see your quality indicator prevalence rates at the provider level, the statewide level, the region level, and you can even drill down to the county level, program and managed care plan levels as well. We have over 80 quality flags at this point, and just some examples are listed here on the screen. So one of them would be no diabetes monitoring for individuals with diabetes and schizophrenia, folks who have low medication adherence with schizophrenia. High utilization flags in our application include folks who have used the inpatient or emergency room services 2 or more, 4 or more, 10 or more times. And then we have eligible for Health Home Plus quality indicators. So that would look at folks who are eligible for Health Home Plus and aren't enrolled in a health home or aren't receiving Health Home Plus services in the past 3 months or 12 months. And then the last bullet just notes that we do have what's called performance tracking indicators in our application. And these are run by the Department of Health and are calculated on mature Medicaid data to allow for all complete data to come into our application. So we have a different as of date for these measures in the application. So it's just something to keep in mind based on what quality indicator you're looking at, what the specific as of date is for that measure. And I'll make sure to point that out when we review those later on in our training today. Now, what types of reports are available? We have the individual client level reports. So this includes the client level clinical summary. So that's where you'll see the Medicaid and state database treatment history. And it can even be beyond 5 years worth of data at this point. We show all available data that we have. We also have provider level reports. So my QI report, that's somewhere you can see your agency's current performance on all quality indicators. You could drill into an indicator and review the list of clients who are flagged or meet that flag's criteria. And then you can also enable access here. We have recipient search. So this is where you can run ad hoc reports to help identify those cohorts of interest. We have what's called advanced views on our recipient search results page, and I'll show an example of this today. And then you can also, of course, enable access here. Then our usage reports, those are used to monitor protected health information access by staff. And our utilization reports were really built to help support provider value-based payment data needs. And then statewide reports, here you can select a quality indicator and review the statewide proportions by different levels, like provider location, region and county, client residence, region and county, plan, program type, network, by provider, etc. Okay, so let's get into accessing client level data. So clients can be linked to your agency either automatically or manually. So if they're linked automatically, that means they've had a billed service at your agency within the past 9 months, or they're currently enrolled in your health home or care management agency according to DOH MAP. Now, if they're linked manually, that means you as the provider or the PSYCKES user logged into PSYCKES and attested to one of the following, that the client signed a consent, whether it be the PSYCKES, DOH, or BHCC consent. You can attest that there is verbal consent that was obtained, You can attest that there was a clinical emergency or that the client is being served by or transferred to your agency. So here's just some more details on what each level of access will provide you for client data. So signed consent, that's the top option you can get. It gives you access to all available data. And what that means is you can even see data with special protections. And that includes data on substance use, HIV, family planning, and genetic testing. And this provides you access to all data in that clinical summary for 3 years after the last billed service. So if you continue to bill for that client, that 3-year time frame keeps renewing. Then we have verbal consent. So this is a little bit different. It allows access to the clinical summary, but just to limited data. So it does not include that data with special protections. But you do get access to the clinical summary for 9 months after you attest verbal consent was obtained. Clinical emergency, this allows access to all available data, including that data with special protections, for just 72 hours after it's attested to in the application. And then attestation of service. So that means the client's currently being served by or transferred to your agency. This will just link clients to your recipient search reports, but it will not provide access to that client's clinical summary. So I wanted to just give a little bit more detail about what a clinical emergency, the description of a clinical emergency. So if a client refuses or is unable to consent and is having a clinical emergency, you as the provider are permitted to quote unquote break the glass in PSYCKES to view that clinical summary without consent. So a clinical emergency is defined as a medical or behavioral health condition for which there's an immediate need for treatments and symptoms are of sufficient severity that the absence of immediate treatment would likely result in serious harm to self or others. So there is some criteria for breaking the glass, and here's just some examples, and it's not limited to just these examples. Threats or attempts of suicide or bodily harm, homicidal or other violent behavior, inability or refusal due to mental illness to provide for their own essential needs, and then overdose, sedation, altered mental status, etc. So it's really up to providers to ensure that the medical record supports emergency access by documenting why and how the client meets criteria for that clinical emergency and making sure you're documenting the signature, date, and timestamp of that clinical emergency. So you can enable access through recipient search. That's just one of the ways. You can also enable access through My QI report or our registrar menu, but today we're just going to go through the recipient search workflow to enable consent or enable access. So we have the recipient search individual search screen, and here you're going to enter in a recipient identifier and click search. So that includes a unique identifier like the Medicaid ID or Social Security number. If you don't have those, you can also enter in their full last name and either their date of birth or their first name. And you can even add on some characteristics like age, gender, race, ethnicity, client region, or client county. So we have toggled to the recipient search tab in the purple navigation bar at the top, and we're on the individual search page. So here's an example of where you can enter in a specific recipient identifier. In this example, we've entered in someone's Medicaid ID, but again, you have those other options to search for somebody below. So we've entered in a Medicaid ID, and we're going to select individual search on the top right. And now here's our results page. So since we used a unique identifier, we have one result that was returned. And you can see this person's information is not clickable. We cannot drill into their clinical summary. So what we can see is their name, date of birth, their age, their unique identifiers, race and ethnicity, their address, their Medicaid managed care plan, if they meet any quality flag criteria, the planning considerations column if they have any notifications or plans and documents, and then current PHI access. So you can see here we have no access, but we have the option to enable access. So we're going to click on that enable access button. Now, a pop-up will appear showing our Enable Access module. So here's where you'll select the level of access that you want to attest to in the application. So the first three options are assigned consent. So that includes, again, PSYCKES, BHCC, or DOH signed consent. Other reasons for access would include verbal, PSYCKES consent, or the clinical emergency option. And then if you're attesting to serving the client, that is the last option at the bottom. So in this example, we're going to click on a clinical emergency. And I always like to point out on the top right, we have the About Access Levels link that just describes each access level that's available here in case you're ever curious what each one means. So we've done clinical emergency. The next screen is just to make sure that you're confirming that this is the correct individual before enabling that access. So just reviewing their unique identifiers, date of birth and address. And then how do you know this is the correct person? Are you attesting to their identity, or did they provide one form of photo ID or two forms of non-photo ID? And then at the bottom, you'll see a little note depending on what access type you've selected. So since we've done clinical emergency, we can see Main Street Clinic will be given access to all available data for 72 hours. So we can enable right here, which would bring us, which would enable clinical emergency access and bring us back to our results page, or we can enable and go right into the clinical summary. So we just selected enable here. Now we're back on the results page. We can see that their name is clickable, and we can see the new current PHI access is now all data emergency. So maybe after the emergency is over, you're able to get their consent. This is where you can go to update their access to attest that consent was obtained. All right, so that's how to access client level data. Now we're going to go into population health with recipient search. So with recipient search, a client is linked to your agency in the recipient search screen if you've billed for them in the past year, or if they're currently linked through MAP, meaning they're in outreach or health home enrollment through MAP. Now, recipient search, again, is used to search for either an individual client like we've just done, or you can do a group cohort search. And we just have some examples here of some group cohort search filters that might be related to the work that you do as a crisis worker. So we have high intensity service filters. We have the option to search for individuals who have alerts like a suicide attempt, ideations, opioid overdose, etc. You can also search for individuals who are experiencing homelessness, individuals that are considered complex needs. You can see folks' crisis service utilization that you're serving at your agency, and you can also search for high utilizers. Now, when you run a search on the results page, you can enable access. If you already have access, you can drill into a clinical summary. You can export to Excel or PDF, or you can change to one of our advanced views. So right now we have the Care Coordination Advanced View. We have our newest advanced view, Complex Needs Health Home Plus High Fidelity Wraparound, and I'll show that one today. Another one that might be relevant to the work you do is high need, high risk. So I'll make sure to mention what data is included in that advanced view. Then we have hospital utilization and outpatient providers. So here we are on the recipient search page. We've toggled over to the cohort search tab on the top right. One thing I like to point out is the limit number of results drop down. So that defaults to 50. So if I ran a search right now for, let's say, anyone who is actively in AOT and the results were 100, I would only see 50 client names on the results page because the limit number of results defaults to 50. So if I wanted to see all 100 names, you just need to make sure you modify your search and then edit the limit number of results to a higher number that includes everyone in your search. So let me go through a few different sections on a recipient search screen. One of the first ones I want to mention is our social determinants of health section. So here we have social determinants of health reported in billing. So this is through Medicaid billing Z codes. And what you have here are the SDOH domains. And if you click on the little minus sign, it'll open up and show you all of the SDOH conditions that live within that domain. So you can select up to 4. Here we've selected a few different conditions on the right. And again, you can select up to 4 and run a search on SDOH conditions or domains. Then we have our populations and planning considerations section. So our first filter I wanted to look at today was high need population. So this is where you can search for individuals who are, for example, eligible for core services, or folks that are enrolled or discharged in on-track early psychosis program. You can see folks who have had intensive mobile treatment in the past year, individuals that are likely eligible for high fidelity wraparound services or Health Home Plus. And then you can see AOT specific filters here, folks who are enrolled in ACT, and folks who even have high utilization of inpatient and ER services. And then below that, we have the alerts dropdown. So at the top, you can select to search for individuals with any of the alerts listed below, or you can select a specific alert that you'd like to run a search with, like suicide attempt, ideations, harm, poisoning, or opioid overdose, or even OMH unsuccessful discharge. Beneath that, we have our homelessness alert. So this is divided up into DHS homelessness data versus Medicaid data. Or at the top, you can run a search for any homelessness according to either DHS or Medicaid. So this is one of our filter examples where it's a multi-select option. So if you can select up to 4 here, and if you do select more than one, just keep in mind it's the OR logic. So you can see in this example, we're looking at people who have had shelter in the past year, according to DHS, or behavioral health shelter in the past year, or safe haven or stabilization shelter. Then we have our complex needs dropdown. So here is another multi-select feature option. So at the top, you can search for individuals who meet any of the complex needs criteria, or you can go below and select general eligibility criteria or additional eligibility criteria for children and adolescents. So you can multi-select up to 4 different complex needs filters here. And I do have the complex needs criteria listed out right on this screen. There's quite a few of them, so I wanted to make sure everyone had the full list here. So this will be sent out in the slides for reference. I won't go through every single bullet, but just as a reminder, it's divided up from all ages for general criteria and then additional criteria for children and adolescents, specifically 0 to 20 years old. All right, and one of our newer filters that we have in populations and planning considerations is our plans and documents filter. So here you can search for individuals who have any plan or document in their clinical summary, or you can search for by a specific plan or document type. Like for example, maybe you just want to see folks that you're serving who have a safety plan attached to their clinical summary. Just to note here, if you do run a search, let's say for a safety plan or document, on the results page, you can see anyone who has a safety plan in their clinical summary, but you will need consent or emergency access to actually drill into their clinical summary and view that specific plan or document. Then we have our quality flags section. This is updated on a monthly basis, our quality flags, but I just wanted to point out here, this is where some of our high utilization quality indicators live. So here you can see if folks have had 2 or more inpatient or 4 or more inpatient visits based on behavioral health, mental health, or medical, or you can see who's had 2 or more or even 10 or more ER visits for mental health, all cause, or even behavioral health. If you're ever not sure what the definition is of one of our quality flags, you can click on the definitions link on the top right of this section. And we also have technical specifications for our PSYCKES run measures on our website as well. All right, now we're going into the services by any provider section. So here is where you can select a specific service setting category right now we've opened up the crisis service category. If you toggle that little minus sign open, you can see all of the crisis related service settings beneath that. So in this example, we have any crisis services. We have crisis stabilization centers, intensive or supportive, mobile crisis, follow-up or response, intensive crisis residence, and so on. So this services by any provider section will look for individuals you're serving at your agency who have received a crisis service, for example, from any provider in New York State, not just specific to your provider. If you'd like to look at your provider specifically, we do have a services specific provider section right above this that'll have your agency name pre-populated in the provider section. And if you do offer crisis services, you can toggle that open and search for individuals who have received a specific crisis service at your agency. Coming soon also, I just want to mention we hopefully will be adding the mobile crisis DOHMH service setting here along with SOS and hopefully CTI. So just a little sneak peek of what's to come. All right, now we have our service utilization. We're still in the same section, services by any provider, but this is a helpful way to search for individuals who are quote unquote high utilizers. So you can search by a specific service type like clinic, ER, or inpatient. And then once you select the service type, you can select the specific number of visits. So in this example, we have folks who've been to the ER for mental health diagnosis, services, or CPEP visits, 10 or more visits in the past year. So that's one example of how to search for high utilizers as well. All right, so we've run an example search here. We have logged in as Main Street Clinic. We've selected folks that have had any alert associated with their clinical summary and have also received a mobile crisis response service from any provider in the state. So 255 recipients meet that criteria. And now what I can see on my results page are that's de-identified for this training, but you can see their name, gender, and age, Medicaid ID, date of birth, race and ethnicity, managed care plan, any quality flags they meet criteria of, planning considerations, and then the current PHI access for that individual. One of our newer features we've just added is planning considerations. This column provides data on notifications, for example, you can see if somebody meets complex needs, Health Home Plus criteria, if they're high mental health need, mental health placement consideration, or even if their Medicaid recertification is due within the next 3 months. Those are just some examples of notifications you can see here. And you can also see if they have any documents attached to their clinical summary, like a safety plan or a psychiatric advance directive or PAD. And you can see the date that the most recent document was added on. And I like to point out that this column has data available even if you don't have consent or access to that person's clinical summary. You can still see notifications and document information in that planning considerations column, even without access. So what we're going to do here is change to an advanced view. So on the top right of the page, there's a little eye icon we can click on. And this is where you can see a description of each advanced view. So we're on our standard results page, but these advanced views will add on additional columns to that standard results page view. So we'll be looking at the complex needs advanced view today. I did want to mention the high need, high risk might also be helpful for you. So that would add on columns to see who on your results page has had an OMH unsuccessful discharge, who has TAY, transition age youth, OPWDD New York Start eligible, if they're likely eligible for high fidelity wraparound or Health Home Plus, if they have a history of homelessness or AOT, if they have a suicide risk, overdose risk, or are part of our PSYCKES registries. So this high need, high risk advanced view might also just be helpful for any of the group cohort searches that you run. But for today, we've toggled on our complex needs, Health Home Plus, and high fidelity wraparound advanced view. And you can export this to Excel to alter the report in any way you'd like. So if you're only interested in, let's say, Health Home Plus eligibility criteria, you could remove any columns that might not be helpful for you, and just look at those Health Home Plus specific columns. So what we have here is the first few columns are our standard results data. So we have name, Medicaid ID, date of birth, I think this is age, and then also the race and ethnicity and Medicaid managed care plan. Now, these three columns that are added here and highlighted are available even without access to that person's clinical summary. So here I can see, even without access, this person meets complex needs criteria and is likely eligible for high fidelity wraparound services. Now, if you don't have access for a person's data, you will only be able to see information in these columns. The rest of the columns in the specific criteria to the right will be blank. If you do have access to their data through consent or emergency access, you'll be able to see what specific complex needs, Health Home Plus, and high fidelity criteria that they're meeting when you scroll to the right and view the extra columns. So if we scroll over, we can see a risk category. So we have AOT, CNYPC release, homicidal ideation, if they've had any history of a suicide attempt or opioid overdose in the past year, if they've been homeless, if they have K3 serious emotional disturbance. You'll see a yes in the column for the specific criteria they're meeting. And if you go to the right, you can see foster care, if they've had 3 or more inpatient mental health visits in the past 13 months, state PC inpatient discharge, 3 or more inpatient medical and schizophrenia bipolar diagnosis in the past 13 months, 4 or more ER mental health visits in the past 13 months. If they're ineffectively engaged or if they've had 1 or more inpatient for mental health in the past 13 months. And some of these criteria are specific to youth only, so you'll see that in parentheses at the top of that column. So if we keep scrolling, we can see more youth-only criteria, if they've spent time in a residential treatment, if they've had children's community residence or residential SUD treatment. You can see if individuals have been ACT enrolled or discharged or have had a Health Home Plus service in the past year with a mental health diagnosis or IMT in the past year. And then lastly, you can see MIT, Mobile Integration Team for Youth, Day Treatment for Youth, Partial Hospitalization for Youth, and then the last section is crisis services among youth. So which youth have had 2 or more crisis services in the past year or have had home-based crisis intervention in the past year. So we'll go into my QI report now. And this tool is really used for helping to manage quality improvement efforts, and it's updated on a monthly basis. So in my QI report, you have the eligible population, which is also known as the denominator. And this looks at clients or episodes, plus any other parameters depending on that quality flag specifications. So that's our denominator. The numerator is the number with QI flag, and that's the clients or episodes that meet criteria for that specific measure. And then you have the prevalence rate. So you can compare your agency's prevalence rate to the region and statewide prevalence rate. And what PSYCKES looks at is the lower the prevalence rate, the better. So you'd want to see your prevalence rate lower than that of the region or the state. You can also filter your report by program type or client residence or provider location, region, and county. You can even filter by folks in the complex needs population. You can drill down to a list of recipients who meet criteria for a specific measure. You can export your reports to Excel or PDF, or you can view prevalence rates for a specific quality flag over time using our QI Trends past year report. So we like to include this slide because it's just helpful to think through how clients are attributed to your QI report versus the period of observation for a quality indicator. So clients are attributed to your QI report through billing if you billed for them within the past 9 months, or they're linked automatically if they're enrolled in your health home or CMA according to MAP. Now, the period of observation for a specific quality indicator, it varies by each measure. So, for example, high utilization, the look back period for that is 13 months. So, just something to keep in mind. If you build for a client in the past 9 months, they'll appear on your QI report. And then for the specific measure, that might have a different look back period. For example, that high utilization measure set. So we've gone to my QI report and we have two tabs at the top of the screen. We have quality improvement and the as of date is more real time. It's right now as of April 1st, 2026. These are our PSYCKES run measures and they're run on a monthly basis. A little bit different from the performance tracking measures, which I mentioned earlier. So these are run by the Department of Health and they have an intentional lag of 6 or more months to allow for that complete data to come in. So you can see the performance tracking measures are as of 10/1/2025. So again, something to keep in mind when you're looking at a quality flag. Think through if it's performance tracking or quality improvement. They just have different as of dates. So let's go back to quality improvement. And here we have on the indicator set tab, we have the indicator set name, the population that can be included within that indicator set. The denominator is the eligible population or episode. So this could either be based on individuals or specific episodes like inpatient discharges to calculate the number in the denominator. The number with QI flag, that's the number of individuals or episodes meeting criteria for that flags or measure set. And then you have the numerator over the denominator. That gives you in purple your agency's prevalence rate. So again, we just want to make sure the lower the prevalence rate, the better. So if your prevalence rate is ever higher than the region and statewide, that might be a measure set or a specific measure that you want to focus on. Now on the top right, we have our filters button. So if you click on that, a pop-up will appear and you can filter by program type, managed care plan or product line, a specific age group, population. You can search for everyone or specifically the complex needs population, and then client residence or provider location. So in this example, we've expanded the program type filter, and here maybe I want to look for the filter related to crisis services. So we have crisis service any, or some of our mobile crisis program types here as well. It really depends on your agency and what program types are being summarized through billing in our QI report. So let's add on the crisis service any program type filter. And you can see our numbers have drastically changed here, so they've gotten a lot smaller. And what I might want to look at now is, for example, the high utilizers at my agency. So in this specific example, we're going to drill into high utilization inpatient ER indicator set. And now we've opened up the indicator tab so we can see all of the available indicators that live within the high utilization set. So in this example, 2 or more ER mental health. So this is going to look at folks at my agency that I've served within the past 9 months that have had any crisis service at my agency and have had 2 or more ER visits for mental health in the past 13 months. So I can see the population for this filter is everyone, all ages. I can see the denominator, which is looking at people who've received 1 or more behavioral health outpatient or inpatient services in the past 9 months. I can see that number is 30. And then the number of QI flags. So out of that denominator, 8 people have had 2 or more ER visits for mental health in the past 13 months. And then I can see my prevalence rate, and it looks like I'm doing better than the regional prevalence rate, but a little bit worse than the statewide prevalence rate. So maybe I want to work on this to get this prevalence rate down and help these individuals come off of this flag, these 8 individuals I'm serving at my agency. So if I drill in to that specific indicator, I can see I land on the recipients tab. So here I have consent for these 2 individuals, so I can drill in. You can see another person down below I don't have access for, but I'm able to enable consent or access if I have it within the QI report feature. And I can export this to PDF and Excel as well. All right, the clinical summary. I'm going to go through this a little bit quicker since we have a lot to get through and we're already at 2:40. So the clinical summary summarizes up to 5 years worth of treatment history for a client, and it's incorporating uh, all databases through an integrated view, and it's sorted like an EMR. So we have different sections within the clinical summary to help support rapid review of those treatment episodes. So these are the different clinical summary sections that we have. I won't go over each one just for time's sake, but this will be included in the slides. So when you drill into a clinical summary, the data has been de-identified here, but you can see a person's name, their general information. We land on the brief overview screen. So this is really just a snapshot of the most critical information you can find within the full summary view. So the brief overview is really 1 to 2 pages at most to really help support that rapid review, especially in a crisis setting. So you can see the as of date at the top. Again, this is updated on a weekly basis. And some of our features I just want to point out, one of our newer ones in the current care coordination section, you can see information on health homes, if that person's enrolled or in outreach. In this example, you can see this person is enrolled in Safe Options Support. You can see the SOS team name and the main contact information. We also have notifications. So here this person does meet complex needs criteria, and you can see what specific criteria they're meeting. Same with Health Home Plus and high mental health need. And one of our newer features is mobile crisis data from DOHMH. So you can see the mobile crisis team name, the referral date and source, the presenting problems and provisional diagnosis, the case, if it was open, and the status. The transportation details as well are included here. And then the brief overview also includes any alerts that the person has had, the number of alerts, the alert type, the most recent alert, and then the provider that that alert was billed for at or through NIMERS. And then if you scroll down, we have towards the bottom, I just want to point out the all hospital and crisis utilization section. This is where you can see specifically what crisis services someone has received in the past 5 years. So we can see this person has had mobile crisis follow-up, mobile crisis team services, crisis stabilization center, and even crisis respite beds at a state PC. So we've toggled over to the full summary view, and in the full summary view, you can see a bit more detail for each service that someone has received. And you can export this summary view to PDF and Excel. So we have the alert section, and here just to get a little bit more detail, you can actually drill into the alert and see the alert type, the reporting and billing provider, the reporting and billing program, the date of incident or service, medical classification, and the source, whether it was Medicaid or NIMERS. Next, we have plans and documents. So this is just a helpful section. If you are interested in seeing if someone has a safety plan, for example, you can go down to the plans and documents section. If you worked on creating a safety plan with someone, you can use the create new feature and go through the Stanley Brown safety plan template here, or even create a pad using our fillable pad template and create a new plan that way. You could also upload any other type of documentation here to their clinical summary, like a care plan, a discharge plan, etc. We have screenings and assessments. So here you can see if someone's completed a PHQ-9 or CSSRS. Social determinants of health. So here you can actually click on an SDOH condition and it'll show you when that condition was billed for and where, and if there are any other diagnoses that accompany that bill. We have diagnoses broken out by behavioral health and medical. Again, you can click on that diagnosis and see when and where that individual received that diagnosis, and if there were any other diagnoses that went along with that claim. The IVOS graph, this is just a helpful way to visually see someone's service utilization patterns. So here I've just highlighted some of the crisis-related services somebody can receive. So if you actually hover over one of the dots on the IVOS graph, you can see the provider name and the date of that service. You can also toggle to a table view and see additional details like diagnosis or procedures. Then we have a dedicated crisis services section. So here you can see the crisis service type, the provider that provided that crisis service, the admission and date of service or discharge and date of service, along with the number of visits and length of stay, the most recent primary diagnosis for that crisis service, and then the most recent procedure as well. And again, with our newest service type, which is mobile crisis DOHMH, the most recent procedures would actually give you more information about the modality of contact and those transportation details. And then hospital ER, very similar to the crisis services section. You could see somebody's ER, inpatient usage, and you can see what type of usage it was, whether it was for SU, substance use, mental health, or medical cause. Right, I'm going to go into the Psyches mobile app now. Just to give a brief overview of what the Psyches mobile app does is it's really designed for mobile workers or crisis workers or people out in the field to rapidly pull up treatment histories to help individuals that are in crisis or even those receiving community-based care. So what you can do is open up the mobile app, log in, search for an individual, if you have access, or if you don't, you can enable access. We have an e-sign consent feature, or you can even enable emergency access if the client meets that clinical emergency criteria. And if you're able to drill into the clinical summary, you can see the full summary view right within the mobile app. So it's just an easy way out in the community to see if somebody has, specific medications they're taking, if they have a safety plan. You can even complete a safety plan within the mobile app or a screening or assessment. And it is free in the App Store. So here's what that looks like. You log into the mobile app and you can search for a client using their Medicaid ID, social security number, or name. And we have the results page right here where you could see the client identifying details. And if it's the right match that you found on the results page, here's some of the PHI access options that you have within the mobile app. So it's all the same as the web with the signed consents, verbal clinical emergency, or attesting that the client's being served or transferred to your agency. But one cool mobile app feature is that we have an e-sign consent option right at the top. So we're going to go through the e-sign consent flow today just to show what that looks like. So if you select e-sign consent, here's the steps that will need to be completed. You'll need to confirm the client's identity, review the consent form with the client. The client will then give or deny consent. And if it's given, consent is given, then the client will sign on the screen. So the first screen would be, how do you know this is the correct person? They either, you as a provider are attesting to that, or they give one form of photo ID or two forms of non-photo ID. So the next screen will be our Psyches consent form, and this is where the client will review the consent form, read through it, and then they can decide if they want to give consent or deny consent. So if they give consent, it'll ask who is signing the consent form, either the client themselves or a legal representative. If they don't give consent, then you'll see a consent was denied screen. So if they give consent, then the signature of patient screen will appear where they can use their finger and sign their signature right on your device. You can tap next, and then you'll be prompted to confirm to save the signed Psyches consent form. So once you confirm, you'll see a confirmation message that you're all set, and then you can tap view clinical summary to go right to their full clinical summary view. Just as I mentioned before, the full summary is available on both iOS and Android devices. So recently, we were able to get the Psyches mobile app onto Android, which is great. So if you drill in, you can see exactly what you'd see in the web. So all available data for a client's treatment history. And this includes even all positions of diagnoses, procedures, and even practitioner data included in our mobile app. And then just to show you what a services section looks like, for example, if you go down in the clinical summary to services and drill into either hospital, ER, or crisis, you'll see a service card at the top detailing the specific service types and how many times that service was received. And then below that, you'll see a chronological list of those provider invoices. So you'll see the date of service, the service type, the provider, and then the primary diagnosis will appear underneath that. So if you drill into a specific service, you can see more details like other diagnoses included in that claim, as well as any procedures that occurred during that visit. And then one other thing is you can also filter. So if you're just interested in seeing ER substance use services, you can filter just for that service type, and the list will reflect just those services below. Then you can complete a safety plan in our mobile app. So in the plans and documents section, you can tap complete a safety plan and complete one with the client. You can even save a draft if you're not able to complete the safety plan in its entirety in one round. You can save a draft. And then you can even view with consent or emergency access any previously completed plans or documents. We have screenings and assessments too, which is a mobile app specific feature. So you can, with the client, complete a PHQ-9, a depression screening, or a CSSRS screening right within the PSYCKES mobile app. And then we have iPad exclusive features. So the iPad actually has available the brief overview screen. So it's a little bit different from the phone because there's a left-hand navigation menu. You land right on the brief overview, and then all sections below will be the full summary view. So all available data in the sections below. So this is just a screenshot of what the brief overview looks like in the iPad. And in the iPad specifically, and soon to be the tablet for Android, you also have the services over time graph. So just like the web, you can see the iOS graph, but for the mobile app, it's just restricted to the past year. Okay, we would love to hear your feedback about what new features you'd like to see in our application that would really just help all the work you do, the workflow you have, the types of reports you're trying to run, the data you'd like to see. So we have a few questions, just 3 questions we'd love to poll everyone on the call today. So to participate in our poll, there should be a Slido app option that is shown in the bottom right-hand corner of your WebEx screen. So we're going to launch our first question here. For anyone who's interested in answering, we'd love to know, would you like to see any enhancements added to recipient search? Now, enhancements could be anything that you can think of. So just for some examples, are there any new population filters? Any new filters in general? Would you like to see new demographic or social needs options in recipient search? Are there new service settings that would be helpful? Like CTI, hopefully we'll be adding that in our at the end of this release. Enhanced step down. Are there any other service settings that would be helpful for the work you do? So I think we have launched the poll. Let's see. Yep, we have. So see what answers are coming in. Social needs options would be helpful to some. CTI. Okay, that's great. Hopefully we will have that for you in a couple of months, available for all users. All right, I'm gonna move on. Thank you everyone for answering that question. I'm gonna move on to the next one just for time's sake. And the next question would be, are there any additional data sources that you'd like to see added to PSYCKES? So for example, would cost-related data be helpful? Would O to DA data be helpful? Are there any other data sources that you would like to see incorporated in the application that we might not already have? OTDA. Okay, I'm seeing that a vote for that. That's great. Okay, 2 votes for OTDA. That's helpful. And there might be other data sources we don't have as examples up here. So if any come to mind, um, feel free to type them in. All right, we're going to move to the last question. Thank you so much for those responses. We're going to move to the last question. Would you like to see any functionality updates within the application? So, for example, we showed some multi-select filters in recipient search. Would you like to see more of those in recipient search? Or would you like to see additional look back periods that we might not already have in the application? Is there any other functionality updates that would be helpful for you in PSYCKES? And we can leave that question open. I'm just going to pop on over to how you can submit any additional feedback for specific features you'd like to be added to PSYCKES. You can make a request to our PSYCKES help desk, and the email's on your screen here. But if you are requesting a new feature, it's just very helpful if you could be as detailed as possible when including a description of that feature you'd like to be added, the purpose the new feature would serve, and how this new feature would be helpful for a larger group of users. I think we have close to 30,000 PSYCKES users at this point, so we want to make sure any new feature we add serves a good chunk of our PSYCKES users using our application. So this poll isn't the only way you can submit feedback. Please feel free to reach out to our help desk as well. I'm going to move on to training and technical support as our final item for this webinar. So training we have on our psyches.org website, we have webinars like the one you're on today. We have role-based webinars, feature webinars, release webinars, a large variety of options to choose from. And we also have user guides. So each section of the application, like recipient search, my QI report, statewide reports, they all have their own dedicated guides on our website. And then short how-to videos for things like managing your token are also available. And then technical support. If you have any questions regarding PSYCKES, our application, please reach out to psycheshelp@omh.ny.gov. We're available 9 to 5, Monday through Friday. If you have issues with your token or with logging in, we have the ITS help desk available for OMH and state PC employees. And then we also have the OMH help desk for any external non-OMH, non-state PC employees. The OMH help desk would be where you would go. And you can email them at healthhelp@its.ny.gov. I'm going to leave this screen up, but I wanted to check in with Cameron to see if there were any questions that came in.
Michelle, it doesn't look like we have any outstanding questions right now.
Okay, that's wonderful. Thank you, Cameron. Well, if any questions do come up after this webinar, we have our PSYCKES help desk, but I really appreciate everyone's time today. We'll be sending out the slides and recording link shortly, and I hope everyone has a great rest of your afternoon. Thank you so much for joining.